We travelled 9,000 miles to get here, and today there are 9,000 different things I could probably talk about that would be absolutely inspirational.
Pretty early on we saw a chart which sort of looked at food, looked at housing, looked at utilities as being some of the real concerns. And what was interesting really was that I think there's an understanding here that there are much broader determinants of health, and a lot of them are employment, housing, things like that. But we understand all that, we talk about it, but you guys seem to be doing something about it here.
In many ways, you've set a standard that I think we need to work hard to achieve. It should actually be easier for us to do the kind of integration that you're doing, but you seem to have done it in a way that we're not able to. So that whole sense of not just health and care, but housing, homelessness, the guys coming out of prison, all of that connected into one programme is absolutely inspirational.
I always knew that Contra Costa was a special place. I've been here before, but I've only been to the hospital. So to be taken out of that and to see what happens outside of the boundaries of the hospital has been a great experience. And you can really see that it matters to the leadership of this centre what they do and how they're connected with the people that they serve.
The way the teams approach their work feels both quite heavily evidence-based and supported by an understanding of what they're trying to achieve, but also grounded in huge amounts of empathy, focus on their community, focus on the person they're trying to work with, the families they're trying to deal with.
The community you serve, the way it's done, the people who work within your system, they're family, and they are genuinely in this for one another, and it just shines through. I've been reflecting on one of the biggest impacts, something that's really resonated and been apparent throughout the whole day was around the welcoming theme. So we started the morning with a conversation about the welcoming policy that was introduced a few years ago, and welcoming people to visit 24/7. And then after that presentation, everywhere we've been, we've heard the same approach. So whether it was in the psychiatric ED, where welcoming people into the department was mentioned by Teresa. Even this afternoon, talking about people who are re-entering and about having a red carpet, welcoming them home. So it's just been so consistent. It's really clearly very embedded and one of the real values, and I think that's really impressive.
Well, I think the highlights were that coming from the UK, we feel pretty smug. We think we've got a universal healthcare system. So I was quite sort of surprised when I stumbled upon one here, and not just a universal healthcare system, it's actually much broader than healthcare.
We've seen so much of what the organisation is about, which is going beyond its boundary and connecting with people, really showing the humanity of the system.
The two words I'd use to describe it is, one, inspiring, and secondly, totally uplifting.